And I think that's what I try to promote too in my book, is to pay attention to your body and what it needs. Is it'll tell you if you're paying attention. And in that way, you can become much more of an advocate for yourself when you're dealing with your health professional, and become a team player with your health professional. I love my doctor, my internist. He's so patient with me. I know he's trained in the Western medicines, and I always try to introduce to him these Eastern things, these Eastern medicines. And he just kind of looks at me, he doesn't make any judgments, and tries to be sensitive to what, where I'm coming from, and not trying to promote, because I'm trying to stay away from having to take any medicines. As the older you get, as I say, things start to change in terms of your body. And it seems like your body turns against you a little bit. And of course, the Western way of thinking is to, just to treat the symptom. And usually it's a pill, and pills aren't always good for you, especially if you're going to have to take them for a long period of time. It erodes, deteriorates your organs, especially your liver and your kidneys. Again, I write about it in my book, because those are the organs that processes everything that you put into your body. It kind of becomes the filter. And if those organs are overworked because of the pharmaceuticals that you're putting into it, you're going to have a hard time as you get older in life. And I know that the medical community, especially if they're Western trained, they kind of keep an eye on those functions, those organ functions, especially if they have you on some medicine. I have blood pressure medicine that I take that I'm trying to wean myself off of, and looking to substitute food as medicine, right? To address the blood pressure. And I'm learning about some of those foods, the spices and things that will help with that, and will eat that, those things too. But it's about paying attention to how they're feeling, and having some awareness about how the body functions, and becoming a partner with your healthcare practitioner as to how you need to address these things to manage or treat. And then certainly prevent, because I'm always into prevention. We're talking about prevention in terms of whatever, social situations affect you. But I think prevention in healthcare is the way to go too. It's much less expensive, much more practical to buy the spices and the foods that are going to contribute to your health than it is to take medicines that are, the pharmaceuticals that are so expensive, and, can really eat a hole in your wallet over a period of time, let alone any effects from that might, put you in the hospital, which is another costly thing. So if you can prevent that by turning to your pantry or your refrigerator, where it's much less expensive for treatment, but also for prevention, I think that's certainly the way to go. But it's all a matter of paying attention to what your body is telling you is going on, and how you should respond to it.